welcome you on behalf of AICOG 2018 from Bhubaneswar. You are watching this interview on MQR AICOG TV. With me is Dr. Jayesh Kumar Patel. Sir has travelled from Surat. Sir is having specialization and he has expertise in fetal medicine. Sir is working currently in Paranu Hovan Super Speciality Hospital at Surat. Sir has chosen a very right topic, karyotype in OBG. Sir, what are the diseases where, or what are the screening procedures, or what are the diseases where you have to focus about this karyotypes?
Actually, there are screening procedures from which we choose the patient who require the karyotype procedures, that is Down syndrome screening procedures. Another is sonography we do, first trimester sonography as well as second trimester. In these two sonographies, if you detect certain anomalies which requires karyotyping, or in certain markers, markers are not abnormalities, they are just some deviation from normal, and in that case also we need to have karyotyping to be done. For screening, I would like to add not only the screening for chromosomal abnormality, we should recommend screening for thalassemia, especially in India, because India is capital of thalassemia all over the world, and thalassemia screening should be mandatory all over the India. Government should try to reduce the cost of testing, and that should be one thing I want to convey to the public. One more screening is PIH screening, that is taking up. In first trimester sonography, we do uterine artery Doppler and do the screening. Now there are biochemical markers available for PIH also. And third screening is a preterm delivery screening, that is also done in first and second trimester sonography by measuring the cervical length. So these screenings are taking up, and we should recommend to all pregnant ladies.
Right, sir. Sir, would you like to speak upon this fetal invasive procedures?
Yeah, a lot of fetal invasive procedures now are available in India. My center is a small center in Surat, and we provide almost all needle procedures, plus we also do fetal umbilical cord coagulation. We also do intrauterine transfusion, all amniocentesis, chorion biopsy and cord blood sampling also we do. We do all type of shunt procedures, like in case of bladder obstruction, we put shunt and drain the bladder to prevent the damage to the kidneys. We do shunts for pleural effusion. So shunt procedures are also available. In India, there are higher centers like AIIMS or Mediscan at Chennai, where the fetoscopic laser surgeries are also now available. The open fetal surgery is still not available in India because it is done in very few centers all over the world. But the exit procedure means ex utero intrapartum therapy, half of the baby is delivered, they do the procedure, either correction or at least intubation of the baby, and then rest of the treatment is done postnatally. Right. So that is available in a center like AIIMS.
Okay, sir. So newer trends with respect to fetal medicines?
The world of fetal medicine now is moving towards the first trimester. Okay. Initially we were doing abnormality scan in second trimester around 18 to 20 weeks, but now in the first trimester we get lot of information. We can predict whether the mother is, how much risk is for preterm delivery. We can predict how much is the risk for pregnancy induced hypertension, preeclampsia, as well as we can predict Down syndrome risk. So almost majority of the risk factors which are associated with pregnancy can be predicted in first trimester. 70% of the abnormalities, structural abnormalities, we can detect in the first trimester. So first trimester scan is now gaining a very much important role, and another is a conceptualization. The fetal medicine is moving towards the concept of fetus as a patient. Lot of things we start treating in utero rather than waiting till delivery, so that early correction and early management is possible.
Right, sir.
So now you can call me as a doctor of the fetus which is inside the uterus.
Right, sir. Thank you, sir. Thank you for your time, and thank you for sharing that info, sir.
Thanks a lot.